Bismillahirrahmanirrahim. Quote of the day. Prophet Muhammad sallallahu alaihi wasallam said, "One who treads a path in search of knowledge has his path to paradise made easy by God." I'm Dr. Muneeb, and today I'm going to discuss about the rubella under the supervision of Professor Dr. Saira Afzal. So, what is rubella? Rubella is a disease which is caused by the rubella virus. Rubella is usually a mild illness. Most people who have had rubella infection or the vaccine are protected against the virus for rest of their lives. The teratogenic property of the infection was documented by an Australian ophthalmologist, Greg, in 1941. Because of routine vaccination against rubella since 1970, rubella is now rarely reported. So, rubella is also called as a three-day measles or German measles. Its family is Tagoviridae and genus is Rubivirus, and in general, it belongs to Togavirus group. Rubella is a RNA virus. Its diameter is 50 to 70 nanometer, enveloped spherical, and it carries hemagglutinin, and virus multiply in the cytoplasm of the infected cell. Epidemiology. So, rubella is worldwide in distribution, occur around the years, and epidemics occur every 20 to 25 years. Infection is transmitted by the respiratory route, and the use of a rubella vaccine has eliminated both epidemic and endemic rubella in USA and several developed countries. Main clinical event, the clinical events occurring in the neonatal age is more important and divided into two groups. One is a postnasal rubella, and second is congenital rubella. And how adults acquire the infection. Acquired infection, not congenital, rubella is transmitted by airborne droplet emission from the upper respiratory tract of active cases. The virus may also be present in the urine, feces, and on the skin. And there is no carrier state. The reservoir exists entirely in the active human cases, and the disease has an incubation period of 2 to 3 weeks. So this is the picture showing the systematic events of rubella. There's an entry and exit from the nose. Then there is a spread by the blood, and it affects the lymph nodes, and it causes the rash and fetal abnormality. Postnasal rubella occurs in neonates and childhood. Adult infection occurs through the mucosa for upper respiratory tract, spreads to cervical lymph nodes. So viremia develops after 7 to 9 days, lasts for 13 to 15 days, then leads to the development of antibodies. The appearance of antibodies coincide with the appearance of rashes. So in 20 to 50% of cases of primary infections are subclinical. So clinical findings are the malaise, low-grade fever, morbilliform rash. Rash starts on the face through the extremities, which rarely last more than 5 days, and no specific feature of the rash give clues to definitive diagnosis of rubella. When epidemic occurs with a similar feature, it is more suggestive of rubella epidemics, and other enterovirus infection can produce the similar manifestation of the rash. So this is the picture which grossly show the rash of the rubella virus. Other manifestation and complications. It may produce transient arthritis in women in particular, and serious complications are thrombocytopenia, purpura, and encephalitis. Immunity. So rubella antibodies appear in the serum as rash fades and antibody titer raise. There is a rapid rise in the antibodies in 1 to 3 weeks of infection. Rash is in association with the detection of IgM indicate recent infection, and IgG antibodies persist for life. One attack of rubella protects for life. Immune mother transfer antibodies to offspring who are in turn are protected for 4 to 6 months of their life. Diagnosis of rubella in adults. Clinical diagnosis is unreliable. Many viral infection mimics the rubella, and specific diagnosis of the infection is done with the isolation of virus and second with the evidence of seroconversion. Nasopharyngeal or throat swab taken 6 days prior or after the appearance of the rash is a good source of rubella virus. Using cell cultured in shell while antigen can be detected by the immunofluorescent methods. Serology. So hemagglutination inhibition test for rubella is of diagnostic significance. ELISA tests are greater importance, and a raise in antibody titer must be demonstrated between two serum samples taken at least 10 days apart. And detection of rubella specific IgG must be detected in a single specimen. Spread. Once a person is infected, the virus spreads throughout the body in about 5 to 7 days. Symptoms usually appears 2 to 3 weeks after the exposure, and the most infectious period is 1 to 5 days after the appearance of rash. When a woman is infected with rubella virus early in pregnancy, she has 90% chances of passing the virus on to her fetus. This can cause the death of the fetus, or it may cause CRS, which is a congenital rubella syndrome. Infant with CRS may excrete the virus for a year or more. Now, congenital rubella syndrome. Maternal viremia with rubella infection during pregnancy may result in the infection of placenta and fetus. The growth rate of fetal cell are reduced, results in fewer number of cells after the death, after the birth, and it leads to deranged and hypoplastic organ development, which results in structural damage and abnormalities. Rubella syndrome, as we can see in the picture, it affects in the eyes and the heart and the brain. In turn, it affects the ear. Rubella infection at various trimester. The first trimester infection leads to abnormality in 85% of cases and causes greater damage to the organs. Second trimester infection leads to defects in 16% of the cases, and after 20 weeks of pregnancy, fetal defects are uncommon. However, rubella infection can also lead to fetal death and spontaneous abortion. Intrauterine infection leads to viral excretion in various secretion in newborn up to the 12 to 18 months of his life. And clinical findings in the congenital rubella syndrome, it may be transient effects in the infant, and it may be permanent manifestation. Permanent manifestation may be apparent at birth because become recognized during the first year, and developmental abnormality appear during the childhood and adolescence. Clinical triad of rubella. The classical triad is number one is the cataract, number two is the cardiac abnormality, and number three is the deafness. So these are the three classical triad in the babies which are affected by the rubella. And other manifestation are the growth retardation, rash, hepatosplenomegaly, jaundice, encephalitis, and CNS defects lead to moderate to profound mental retardation. Other neurological findings that a manifestation of the problems in balance, motor skills in preschool children is altered. A rare complication of panencephalitis can occur in second decade with congenital rubella syndrome may progress to death. Diagnosis of the congenital rubella syndrome, the demonstration of the rubella antibodies of IgM in a newborn is a diagnostic value, as IgM group does not cross the placenta. Treatment and prevention. So, rubella is a mild, self limited illness. No specific treatment or antiviral treatment is indicated. However, laboratory proved and clinically missed rubella in the first 3 to 4 months of pregnancy is associated with fetal infections. Treatment, prevention, and control. CRS can be prevented by effective immunization of the young children and teenage girls and remains the best option to prevent congenital rubella syndrome. The component of rubella in MMR vaccine protects the vaccinated peoples. Rubella vaccine. Rubella vaccine is a live attenuated strain, and a single dose give more than 95% long-lasting immunity, which is similar to that induced by the natural infection. Rubella vaccine are available either in monovalent formulation, a vaccine directed at only one pathogen, or more commonly in combination with other vaccines, such as with the vaccine against the measles and mumps MMR, or measles, mumps, and with varicella, so MMRV. Um, the MMR vaccine is a mixture of three live attenuated viruses administered via injection for immunization against measles, mumps, and rubella, and it is generally administered to the children around the age of 1 year, with the second dose starting before the starting school. CDA recommends all the children get 2 doses of MMR, measles, mumps, and rubella vaccine, starting with the first dose at 12 to 15 months of age and second dose at 4 to 6 years of age. Children can receive the second dose earlier as long as it is at least 28 days after the first dose. Second dose is not a booster. It is a dose to produce immunity in small number of persons, 2 to 5%, who fails to develop measles immunity after the first dose. In the United States, the vaccine was licensed in 1963 and the second dose was introduced in 1990. And it is widely used in all national universal immunization programs. Reactions of vaccine. Adverse reaction following the vaccination are generally mild. They may include pain, redness at the injection site, low grade fever, rash, and muscle aches. Most mass immunization campaign in the region of America involving more than 250 million adolescents and adults do not identify any serious adverse reaction associated with vaccine. Now it's time for the recent updates. This is the article which was published in recently in Pakistan. That is the seroprevalence of rubella IgG in pregnant females. And in the abstract, the objective of this study is to find out the seropositivity of IgG rubella in pregnant women in Pakistan and to assess the prevalence of infection to estimate the requirement of vaccination. So in the results, in total 730 subjects was included in the study and divided into the groups according to their ages, and the results are follow. The group 1, which is between 18 to 20 year, they have 100% IgG positivity. Group 2 has 90.5, group 3 has 93.5, group 4 has 95% IgG seropositivity overall. So overall it was 92.32 seropositivity, with 7.70% were found at risk for developing rubella infection. It's time for the MCQs now. Question number 1. The immunity of body makes the antibodies against the rubella virus. Antibodies started to appear in the serum after the rash fades. What is the time for the rapid raise of antibodies? Number A is 1 to 3 weeks, B is 2 to 4 weeks, C is 5 weeks, D is 6 weeks, and E is 7 weeks.
B.
The answer is alpha. The rapid rise of antibodies occur in 1 to 3 weeks of the infection. Question number two. A pregnant lady presented in the OPD in her last trimester. The doctor are to give awareness regarding congenital rubella syndrome. So, which of the following is true regarding the congenital rubella syndrome? It affects the eyes, ear, and heart. It's only occur if mother is infected during the first trimester of pregnancy. It can be treated with antibiotics. It is not a serious condition. It can be treated with antivirals.
B.
It's alpha. It affects the ear, the classical triad, we can say. It affects the ear deafness. It causes deafness and it causes blindness, considering the eyes, and it affects the heart. It causes PDA. Question number three. A vaccinated pregnant lady presented in OPD with a routine checkup, and she was curious whether she can get rubella infection or not. Rubella immunity can be determined by measuring the levels of which of the following. So A is CD4 T cells, B is IgM antibodies, C is IgG antibodies, D is NK cells, and E is IgE antibodies.
B.
The active infection will be checked by the presence of IgM antibody, but here the answer is C. IgG antibody will be checked for the rubella immunity. Question number four. Which one of the following is the most common neurological complication of rubella? A is encephalitis, B is meningitis, C is Guillain-Barré syndrome, D is myelinitis, and E is brain abscess. A is the right answer. Encephalitis is the most common neurological complication of rubella. Question number five. Rubella vaccination is recommended by WHO, and a big area of the world has been covered by this vaccination. So, which of the following is true regarding rubella vaccine? It is only recommended for the pregnant woman. It is a live attenuated vaccine. It provides lifelong immunity. It can cause congenital rubella syndrome in a developing fetus, and it provides 100% immunity.
Beta.
Yes, beta is the right answer. It is a live attenuated vaccine. Question number six. Dr. Kasim was given a task to run a program for the awareness of rubella. During the training of the staff, he told about the epidemiology of the rubella. So, which of the following is true about rubella epidemiology? Number A is rubella is highly contagious and easily transmitted. B is rubella is primarily transmitted through fecal-oral route. C is rubella outbreak occur only in developing countries. D is rubella cannot be eradicated with current vaccination program. And E is rubella affects only young adults.
A.
A is the right answer. Rubella is highly contagious and easily transmitted. Which one of the following is not a risk factor for rubella infection? A is being pregnant, B is being immunocompromised, C is traveling to endemic region, D is eating contaminated food, and E is being unvaccinated.
A.
Delta is the answer. Eating contaminated food is not a risk factor for rubella infection. Question number eight. Which one of the following is the most effective way to prevent rubella infection? A is wearing a face mask. B is washing hands frequently. C is the vaccination. D is avoiding contacts with the infected individual. And E is washing face frequently.
C.
C is the right answer. Vaccination, in the case of rubella, is the most effective way to prevent the infection. Question number 9. Rubella virus belongs to which family of viruses? A is flavivirus, B is retroviridae, C is togaviridae, D is orthomaxoviridae, and E is reoviridae. C is the right answer. Togaviridae is the family of rubella virus. Question number 10. A research was done on the seropositivity of IgG rubella in pregnant women in Rawalpindi. According to that research, how many women are at a risk of having rubella infection? A is 5.7%, B is 6.7%, C is 7.7%, D is 8.8%, and E is 9.8%. The answer is C. 7.7% are the women who are at risk of having rubella infection. This is the key, and this is the YouTube link. Please like and subscribe the channel, and thank you.
Thank you so much, Dr. Muneeb. Allah Hafiz.